December 1st, 2019. A patient goes to a hospital in Wuhan, China, exhibiting symptoms including respiratory issues, slight fever, headache, and body aches. December 8th, 2019. About 27 people in the city of Wuhan, Hubei province, China, went to the hospital with symptoms that resembled the flu. At the time, the patients were diagnosed with an unknown pneumonia. For the next few weeks, more and more people exhibited the same symptoms, but were treated as if they had the common cold or flu. December 30th, 2019. Huanan Seafood Wholesale Market in Wuhan, China is identified as the epicenter of the yet unidentified illness. Since most of the original patients that came in were working or living near it, no information was released to authorities outside of Wuhan. December 31st, 2020. Local authorities checked the wet market for any signs of unrest. Everything is business as usual. A statement is released, calming local residents that this is an isolated incident and that there is absolutely nothing to worry about. The yet unidentified virus seems to have spread from an infected animal to about 30 humans in a one-time event. January 1st, 2020. Residents of Wuhan, a Chinese megacity of more than 11 million people, start hearing rumors of human-to-human transfer. People spreading these rumors are actually arrested. Wuhan police arrest 8 individuals for spreading misinformation about pneumonia patients. January 2nd, 2020. Local authorities are adamant that there are no new cases, no human-to-human transfer, no casualties, and most importantly, there is nothing to worry about. 41 admitted hospital patients are confirmed to have the same infection, only 27 of whom had direct connections or exposure to the Huanan Seafood Wholesale Market. Hong Kong officials discovered first cases of the new virus in the region. January 3rd, 2020. Passengers traveling from Wuhan to Shanghai are screened for fever at the airport. January 4th, 2020. First identified case in Singapore. 8 cases in Hong Kong. Fears of a new SARS outbreak are rising. January 5th, 2020. Early investigations into the cause of the mysterious pneumonia rule out SARS, MERS, seasonal flu, and the bird flu. Still, no reported cases of human-to-human transmission. January 9th, 2020. 2019 ncov, short for 2019 novel coronavirus, is identified in a Chinese lab. The World Health Organization, WHO, confirms these findings. Their report also states that the Chinese government has acted swiftly to stop the spread of the virus. There is also the first casualty from the virus, a 61-year-old man with significant prior medical conditions. January 10th, 2020. Global health officials are officially concerned about the novel virus. The gene sequencing data from the 2019 ncov, or Wuhan virus, is isolated. Research into potential vaccines is ramping up. January 11th, 2020. More than 700 close contacts and around 400 healthcare workers are being monitored for symptoms. No new cases have been reported since January 5th. January 12th, 2020. WHO releases guidelines for travel. Nothing alarming, but potential travelers should be aware of the issue and practice good hygiene. Wuhan hosts a provincial meeting of officials from all over Hubei. January 13th, 2020. The first identified case in Thailand is a 61-year-old Chinese woman who was a resident of Wuhan but had never visited the seafood market. She had arrived in Bangkok on January 8th. January 14th, 2020. No new reports of cases. Worrying information about 2 patients coming to light. 2 of the confirmed 41 cases were a married couple, raising the possibilities of human-to-human transfer. Journalists and medical staff from Hong Kong traveled to a hospital in Wuhan. They are later arrested and all footage is taken by the police. There are rumors spreading of filled hospitals and general sense of panic in Wuhan. January 15th, second casualty occurs. A 69-year-old man from Wuhan. January 16th and 17th, 2020. First case in Japan, a 30-year-old male Chinese national. He had not visited the market, but might have had contact with a person from Wuhan. Thailand confirms second ncov case, a 74-year-old woman who arrived in Bangkok by plane. Cases in mainland China rise to 45. January 18, 2020. 17 new cases are confirmed in China. Total confirmed is 62 cases, with ages ranging from 30 to 79. 19 were discharged and 8 patients were in critical condition. The seafood market at the epicenter of the outbreak hosts a banquet organized by Wuhan's local government. Some 40,000 people attend. January 19, 2020. First cases in China confirmed outside of Wuhan. Wuhan reports 136 new cases. The total is now 201. Total fatalities are now 3. January 20th, 2020. First confirmed case reported in South Korea. Cases in China rise to 218. Officials announced that the novel coronavirus can be transmitted between humans. January 21st, 2020. WHO announces an emergency meeting on the virus. Several new provinces in China report cases. Total confirmed cases increases to 312. Fatalities to 6. Of the new cases, 15 were Wuhan healthcare workers. Of those 15, 14 were believed to be infected by one patient. These patients are known as super spreaders. First case of the virus is confirmed in North America, in Seattle, Washington. January 22nd, 2020. WHO has decided not to classify the virus as a public health emergency of international concern, but may do so in the future. New cases are confirmed in Hong Kong, Macau, and new provinces of China. Total cases jump to 571, fatalities to 17. The government of China announces a quarantine on the city of Wuhan. All outgoing flights, trains, and roadways are to be closed. An estimated 300,000 people leave Wuhan before the quarantine takes effect. Total population of Wuhan is north of 11 million people. North Korea closes its borders and bans foreign tourists. January 23rd, 2020. Wuhan suspends all public transportation. Construction of a specialized emergency hospital that can house up to 1,000 patients begins. Lunar New Year celebrations all over China are canceled. All major Chinese films that were poised for release during the week were postponed. January 24th, 2020. In the span of 24 hours, quarantines of cities continue. By now, more than 35 million people and most of the Hubei province is under quarantine. Number of international cases rises. More importantly, the first human-to-human transmission outside of China is observed in Vietnam. 70,000 Chinese cinemas are closed. Major tourist sites are closed, including Shanghai Disneyland and the Forbidden City. Starbucks and McDonald's suspend some operations in China. Russia closes its border with China. Total confirmed cases in China breaks 1,000. January 25th, 2020. Confirmed cases in China are now 1,975. International cases rise to 43. Hong Kong declares a state of emergency and officials vote to close down schools until February 17th. Hong Kong Disneyland and Ocean Park close until further notice. The United States announces evacuation plans of U.S. citizens trapped in Wuhan City. There's also the first reported case of a doctor succumbing to the illness. Authorities announced the building of a second emergency hospital. Beijing shuts down most bus and train services from nearby provinces. Xi Jinping, the head of the Communist Party in China, says the country is facing a grave situation as the number of confirmed infected keeps rising. Suspected cases of the ncov 2019 are popping up all over the world. January 26th, 2020. The United States reports its 3rd, 4th, and 5th confirmed cases. 2 in California and 1 in Arizona. Thailand has confirmed its 8th case. China bans all wildlife trade. The Chinese Center for Disease Control and Prevention starts developing a vaccine against the virus. Hong Kong starts a ban on anyone who has traveled to Hubei province in the last 14 days. Confirmed cases in China are now 2,744. International cases are 56. January 27, 2020. Mongolia closes the border with China and shuts down schools until March 2nd, urging all public gatherings to be canceled. Macau bans anyone from or who has traveled to Hubei in the past 14 days. Border centers between Vietnam and China are shut down. Malaysia suspends all visa facilities for Hubei residents. Canada reports its first case. Germany reports its first case of domestic transmission. Beijing reports its first casualty. Shanghai is effectively shut down as businesses are closed until February 9th. Confirmed cases in China are now 4,515. International cases are 61. The mortality rate is estimated to be less than 5%. Compared to SARS and MERS, it looks promising. January 28th, 2020. International unconfirmed cases are in the thousands. Confirmed cases are now at 87. Inside China, there are 5,974 confirmed cases. The Philippines suspends issuance of visa on arrival to Chinese nationals. Singapore suspends entry of people who are from or have been in Hubei province in the past 14 days. Hong Kong is taking drastic measures to slow down travel from mainland China. The US CDC boosts staffing at 20 airports that will do the screenings of people traveling from China. Which brings us to today, January 29th, 2020. Here are the full statistics and full map of the 2019 ncov virus. I will be making frequent updates on the situation, starting with a video about the actual virus. Let me know how you feel about the situation in the comments below. Check out the featured comment below, subscribe for more World Unearthed, and I'll see you in the next video.